Hey guys, welcome back. So here we're going to run through a little bit about how to, first of all, deliver a real kind of hit home presentation and what it might look like. And then in the second part of this presentation, what we'll do is we'll go through some of those common topics and what little pointers I think that you should be trying to cover in order to kind of deliver something, because it's not impossible that they'll ask you to come up with your own topic. So hopefully there's quite a few new ideas that you can kind of steal from here. Okay, so in terms of giving presentations, the three sort of key things really are: say what you're going to say it, and then say what you've said. So you're almost summarizing the key hit home points that you're going for. And you can kind of go off these 5 Ps. So we've got planning. So that whole process of kind of defining what you're going to talk about and what your hit home messages are is really important. You'll be given a time limit. So how much you can cover in that time is going to be dictated a little bit by the interview stipulations. But again, consider that audience size. So are you doing this to all of the athletes? Are you potentially doing it to a mixture of athletes and the panel? Is it just the panel? And how many of them are there? And can you maybe get them involved? From a preparation perspective, so you need to be making sure again that you're prepped fully for this. So you will have researched your topic, your listeners, structured it according to how you want that to logically flow. And then you're going to design any sort of additional visual aids. That might be images, might be videos, might be sort of little quizzes or whatever it is that you want to use to try and make sure that it's as interactive as you can. Practice it. So this is kind of a bit of an obvious one, this really, but in the early days, I absolutely hated doing any sort of presentations, any public speaking. And the only way I got through that is just to practice and rehearse what you're going to go through. Some of the early presentations that I used to do, I maybe went through them 4 or 5 times before the main event, just to make sure that we could deliver it, make sure your timing was okay, and then also just making sure that you watch that back so you can pick up on some of your own little mannerisms, gestures, and get your tone a little bit better. From a performance perspective, again, that's when you're really thinking about, you've got your content, but how are you going to deliver that content and how are you going to pace it? So sort of affecting the way that your voice sounds, the sort of tone, the tempo, what's your body language going to be, and what are those transitions going to be like? So you're also going to be managing the slide situation at the same time. Any quizzes, anything else you're doing. You really want to get that passion across, so show that kind of genuine energy, enthusiasm, so you can connect with the panel and the audience and try and make sure that they remain engaged throughout. So on the P topics really of presenting, you've got these really. So making sure that you project, you pronounce your words nice and clearly, you pace it correctly. Now I'm a Geordie, so I naturally speak quite quickly. If I'm teaching across in the Far East, in Dubai or Saudi, I have to slow things down considerably to make sure that they can kind of follow what I'm going through. Think about the pitch. So are you just monotone all the way through? Are you trying to kind of vary the way that your voice sounds? And don't forget to put in valuable pauses. I think this is something that I don't do enough of, particularly with this online stuff, but I do this a lot more in lectures and teaching now, where actually sometimes you have a little gap and a pause, and it allows people to think about some of the questions and process that information, just so it's not all a million miles an hour. So a few additional things that I would add, really. So you just got to obviously make sure that you research whatever topic it is. So that's going to be a case of diving into the literature, getting some evidence-based approaches that you have there, and then also bring that in with your practical experiences. So you've got your application that you've shown that you've already done this, and then maybe some additional things that you want to add into the mix. You need to have clarity. So again, when you open up with that introduction, be very clear on what you're going to cover. Keep it really succinct. We don't want people waffling for ages. Think about the objectives and try and make it as relatable to this job as you possibly can. You can give generic information, but there's nothing better than having it really specific to the club that you're applying for. So do a little bit of research in that. The duration, it varies really. You might be someone who wants to spend sort of a little bit more time on certain slides, that's fine. It might be that you just have an image and you talk around it. I really like that kind of approach. You might want to have some prompts, but I'd say roughly what you want to do is look at around 60 seconds-ish per slide. So if you've got a 15-minute presentation, you don't want to be having 40-odd slides that are there. Just ask what's stipulated and try and stick to it. The slide design, again, the colour scheme that you decide to go for, the way that it looks, the aesthetical kind of appearance. Do you want something fun? Do you want something really professional? Do you want something that's incredibly linked to that specific club? So you might use all of their own colour schemes and layouts and badges and things as well. The 5-5-5 rule, I've kind of gone a little bit off with this, but basically they say don't use kind of more than 5 lines of text, don't have more than five words per line, and make sure you haven't got 5 kind of text-heavy slides in a row from there. So I think it's a bit harsh this sometimes, but kind of bad and good design things. There's some little pointers that are over there. The things that I find really tough is if I'm squinting and trying to read the text that's on there, if there's full sentences or paragraphs, particularly if it just looks like it's been ripped off ChatGPT, off AI, and then just plonked into there. It looks pretty obvious. I think it's nice just to have little prompts or little words that you can kind of talk about a little bit more, make it a bit more conversational. Again, the timing of this, so complicated data can be pretty heavy. Make sure you know it really well, and can you present that in a really clear, easy format? And as I say, don't go OD on all the slides. From a presentation and delivery perspective, I think if you're using pretty low quality images, clip art's obviously a no-go. Try and get some really nice, high quality, high kind of res images that'll stand out. Because if you're doing it on a big screen, the bigger the screen that you're asked to present on, the worse the quality will look. So make sure you've got some real nice, high quality, relevant images that are there. Some people chuck in some absolutely random things that don't actually link into what they're talking about. Try and make sure it all flows really nicely. If you're using text, so I really like using videos. For anyone who's seen any of the kind of stuff in the rest of this Grow Physio platform, I try and embed a lot of videos. You just have to make sure they work. Obviously, there's nothing worse than if you're pressing play and nothing happens, and you've got something really pertinent that's in that video. And then other things, all that kind of body language related things as well. And all I'd say is just in addition to that, is add a bit of character, add your own personality, your own little spin on it, your own little USP that helps to make you a little bit more memorable. We talked a little bit about the way you kind of dress and present yourself. Again, it might be that you kind of have a bit of a package that comes with that. From a prep perspective, I think there's nothing worse if people don't know what slides are coming, so make sure you've rehearsed that, and then you can be a lot more intentional with when you have those pauses. I think if you're not really clear, really confident with the slides that you've got, and really familiar with them, you end up kind of rushing through and having to read off the slides quite a lot, so try and avoid that if you possibly can. I think this is something that we don't do enough of, is try and make it interactive. So bring that audience into the presentation. So they'll go from kind of using this back brain to the forebrain and actually start to think about what some of the answers might be. So you're kind of putting them on the spot. Again, we talked a little bit about the fact that you're also interviewing them at the same time. So making sure that their responses are actually really appropriate and in keeping. It'll give you a little inkling into how they are. And again, if you're not confident with public speaking, just practice this, watch it back. Can you do it in front of someone that you're kind of pretty comfortable with? And then just use that kind of Q&A process with them. And then when it's the delivery side of things, again, what you want to try and do is just kind of drive home all those key factors that you want to cover. Now, I think presentations and the way that things look has never been easier. We're not having to design all these slides ourselves anymore, are we? So we can plug in some information, we can stick it into PowerPoint, it gives some design ideas, and you can select something that you think is appropriate. PowerPoint's a little bit sort of hindering, if you like. You don't have that creative flair that you necessarily have with Canva, and you may be limited to some of the changes that you can make. So if you do have access to Canva, I really recommend going on there, even to get some ideas to create some little images that you can maybe even paste into that PowerPoint if that's how you want to try and deliver it. But there's loads of ideas. Again, you don't have to come up with how things look. You've got plenty of examples. So once you look through them, you'll have something that stands out, and you can change the colour scheme accordingly to however you want it. And again, use AI, use it to try and create images that potentially kind of really outline exactly what it is that you want to cover. Maybe some images of yourself that are in there doing certain activities also looks quite nice. But just be careful if you're pulling the information from AI that you're relying on. Remember, the people that are on the panel are likely to be experts. So if you're giving them false information, they're probably going to call BS on you and go from there. All right, so that's a few little pointers. Now, in terms of what you're going to cover, these are a few topics and areas where I think you should be trying to kind of delve into some of this a little bit more. So I'm just going to give you sort of 10 different examples of things, and then just some little tips and tricks of things that we look for and hope that you covered along the way. It's not going to be completely saturated with everything that you need, because that'll just take too much time, but hopefully it gives you a bit of food for thought. So the first question is, talk me through your approach to an athlete who has sustained a grade 2C hamstring tear on MRI to return to high-speed running and training. So there's no harm, is there, in obviously kind of going away and just outlining exactly what a grade 2C is. So we have the hamstring. Which muscle group is it? Which muscle is it? Is it the biceps fem? Is it the semimembranosus or the semitendinosus? Well, it doesn't say, but it'd be nice to put that in. Again, the C indicates that there's some sort of tendinous involvement. So again, the differences of a pure muscular tear versus having a muscular tendinous tear or a muscular tendinous junction tear, they're different, aren't they? So what we're looking for with this question really is, do you understand the diagnosis and the implications of the tendon being involved? And then what we need to do is see you kind of on a logical process going through their return back to running and training again. So to do that, these are a few little pointers that you could consider. So the timescale is going to be key, isn't it? And usually what we do when we have an injury is we have the timescale and then we work back to decide exactly what that athlete needs, and then we plan that process out. As I said, it's going to take a little bit longer if that tendon's involved. We have been burnt before. You only get burnt once, and then obviously allow that additional amount of time and amend the rehab that you do. So I would say circa probably 10 to 16 weeks isn't abnormal. If it was just a grade 2, purely muscular tear, again, you'd probably be knocking that down to kind of 4 to 8 weeks. But the extra C bit really has a big implication, and it's nice to share that in that process. Early loading, really encouraged. Tendon-specific loading principles and strategies, again, are really useful to go through. You might want to be talking about the strength levels that you want to try and hit, making sure they have enough mobility. And again, what else might impact that hamstring? So pelvic control, think about the whole chain from foot and ankle all the way through to anything else that might well be causing it. In the hamstring talk, we talk a little bit about one of the footballers who actually had a bad shoulder, and he wasn't actually extending that arm, so he was creating more of that rotational torque further down, which was adding more load onto that hamstring. I'd like to see you going through again that sort of that testing process, and then that gradual build-up of speed, plyometrics, when they're ready to go into that, and then talk about the training. So what will that look like? We're going to go from basically low and moderate levels of training with lots of kind of controlled environments to that chaos at the other end of that spectrum where it's high intensity, live play, anything can happen, etc. So there are a few little bits of food for thought for there. The next scenario is this. So imagine you've got a judo fighter who's striving to be the best they can be. So this is someone trying to compete at the Olympics. They're competing with lots of different people in their weight category, and they're searching for any of those little marginal gains that can make them 1% better. Obviously, ideally, they'll keep adding all these 1% together, and then they'll be in a better place. So can you talk through how your role and others could be utilized to achieve this? So have a little think. What is it about this question that you feel would be the best way to answer it? You might want to make some notes. here's a few little pointers that I think are really useful to go through. So again, we're going to have to go through what the latest sort of evidence-based and research says in terms of some of those kind of leading principles and approaches to manage this sort of scenario. Is there anything additional that we can offer personnel-wise, yourself or within the MDT, the backroom staff, etc.? Is there anyone else you can kind of have doing mentoring within the program itself, other athletes, for example? And is there any technology that you can potentially introduce that might well help? You need to be able to showcase your skills at this point. So what can you bring to the table yourself? But that recognition that you do have a scope of practice and you can't step beyond that. So we can't start acting the role of a sports psychologist, for example. So we will need the input of other backroom staff. So coaches, strength and conditioning, maybe rehab specialists, nutritionists, coaches, in different kind of components of their speciality, psychology, anything else sports medicine or science-wise to keep an eye on them. Sometimes what you have are universities. So where we were based, we had a university on site who could do a lot of the testing of these athletes and lots of kit as well that we could tap into. So altitude chambers, ice baths, things like that. From a communication perspective, obviously once you discuss that plan, you'll formulate the plan and then deliver that plan. There's going to be some combined goal setting with that between yourself and the athlete and also the rest of the team, and then a real clear outline in terms of what they need to do as the athlete and then what we're going to do, and making sure that it's a nice sort of combined process where we're both singing off the same hymn sheet and both accountable for that. From a review perspective, is you can have an amazing plan, but are you actually sticking to that plan? So putting in regular check-in points to check in with that physical and psychological well-being. Okay, from an injury reduction perspective then, so the manager is blaming the number of training days lost to injury and illness last season as the reason why they've had a poor final finishing position in the league table. What we want you to do is deliver a plan to show how you would reduce the number of injuries and illnesses, so you have more training days, more consistency, and then therefore hopefully a better outlook on the season. So again, a few pointers that I would say is you're really sort of striving to make sure you're not taking on this yourself. This is a collaborative approach, so you're going to get and organise an MDT meeting, brainstorm and think about some of the accountability parts, so build up that kind of environment where people are actually open to looking at different ways that we can improve. You also need some fact to this. So what were the injuries and what were the trends? Did they happen at particular times in the matches? Did they happen kind of during certain parts of the season? Was there fixture congestion? Was it certain pitches, certain opponents? Whatever it was, it's really useful to get all of that data and information together so you're making informed decisions. It's also really useful to make sure that you know what you're currently doing and what else is happening within the industry. So again, could you reach out to other clubs, other teams, find out what's happening there? And then what things could the athlete potentially do? Well, there are wellness apps, so you can kind of self-grade on a RAG rating really in terms of where you're at in terms of soreness, readiness to train, stress levels, etc. What's their nutrition been like? What's their sleep been like? Is there infection control components we can build into this? We started to use bloods as little markers again to kind of outline where people were at from recovery, and then DEXA scans and things like that obviously you can use to try and work out where they're at. And then from a physical perspective, again, is there things that you could do like a monitoring system, a good pre-season? What correctives could you potentially bring in? So if they are down on something like a knee to wall and their calf's really tight, we give them corrective exercises, don't we, to try and kind of get that into a better place before they go and train. What happens if they can do that? Well, great, they can go on and do a bit more mobility and stretching and things afterwards. If they can't change it, then actually what do we need to do? It's far safer sometimes to put them onto an exercise bike or something for that session when their injury risk is higher. Obviously, there's managing all of that and getting the S&C, the coaches, and load monitored really, really well with the sports science team. From a managing injury and kind of re-injury perspective, again, thinking about someone who's maybe managing an injury in season. So this athlete has had a recurrent tendinopathy that's affecting her performance in the season. Can you discuss your options and how you would manage this situation? So they're still able to train, but you're probably finding that they're not able to train or compete at the level that they should be. So what would be the pointers with this then? So I would go through, make sure you've got a full assessment. That would be local to the injury site, a global screening, and then testing. It might be that you're comparing where they were at the start of the season, where there's some deficits that were there that were causing this, what might be some of the clues as to what's going on. Think about the pathophysiology that might well be going on there. So with tendons, thinking about the different tendon continuum stages that they're in and where they're at. It might be that an ultrasound might be really useful to try and find out the quality of that and see if there's any blood or anything within that tendon itself. And then what MDT input could we possibly draw upon? And is there any additional technology or anything that's maybe out there? Shockwave, for example, stripping, for example, that are all things that we use with tendons. Again, you want to try and gather the facts on any of the contributing parts that have kind of contributed to why that athlete has maybe developed soreness in that Achilles, and then any past injury history, and have we maybe had some things that they've been grumbling on with or not maybe got fully on top of before we get into this. Communicate that with the athlete and the coaches and see where they're at. And then obviously kind of what you want to do is execute that kind of evidence-based plan, really. So that might include isometrics. You might talk about certain ranges that you want them to be really strong in. What duration of their holds going to be if you're doing isometrics, how many, what's their training load going to be like, and can we maybe monitor their GPS a little bit closer to find out what stirs that tendon up the most. If they're doing a lot of jumping, plyometric work, maybe some hill runs, maybe they've been in a line out in rugby and doing lots of jumping, again, that sort of stuff is going to aggravate that tendon. And then on a monitoring level side of things, again, we often use a traffic light system, don't we? So we're trying to work out how sore are they, what's an acceptable level for them to keep on training at, what's unacceptable whenever we overcook the tendon, and is there anything alternate that we can do with them? So off-feet training is a classic, load management is something that we need to get on top of. So hopefully you're kind of sticking with me so far. I know these are kind of pretty rapid, but hopefully lots of different examples that you can use in industry. So this one, using examples from industry, how would you balance performance and injury risk when returning an athlete to their sport? And what we have sometimes is maybe an athlete who we have been super safe with and they haven't got injured in rehab, but the gulf and the gap between where they're at and what they are required to do in an actual live match is really different. So how do we make sure that they're as ready as they can be when they hit the ground into that sport? So acknowledging it as a real issue and a challenge is really good, and talk about an example of someone that you've managed within that space. Your role in the process and supporting that athlete. What were the rest of the team doing? So could you draw upon their expertise and shared decision making? Because I think sometimes what we don't want to see is that someone's just going to have this athlete, they're going to protect them, not let anyone else near them at all, not share any of that information. And that's not healthy, is it? So we need to be trying to transition components across to other elements. So if someone's got a left calf tear, for example, and you're looking after that calf, you might well be in sole control of what load goes through that left calf. What goes through their right calf, their trunk, their upper body, maybe is less of a worry for you, so you could hand that over to the S&C or really look at big gains in those areas. And again, making sure that we've got criteria-based approaches. So they might not have re-injured in their rehab, but they haven't hit the levels that are required. Be really open, honest, communicate that, and be really clear with where you're going. Okay, what about from an assessment perspective? So sometimes you may well be asked to talk a little bit about a particular injury and how you'd assess it. So an athlete reports hip pain. Talk through your process in assessment and specific testing you would carry out from initial injury all the way maybe to return to training. So in the initial instance, you're going to go through your subjective assessment, aren't you? So thinking about all the different components that sit within that subjective. really honing in on something that will aggravate that particular hip. That will give you that functional sort of movement pattern that you can kind of base some of your later assessment around. Objectively, again, we're going to go through all of the basics: general observations, palpation, range of motion, both passive and active, and overpressures, strength in different ranges, maybe concentrically, eccentrically, etc., and then any special tests that we might well be doing. The functional assessment, again, you're going to try and replicate the movement that maybe irritates it and use that as something that you use as an objective marker to compare before and after maybe a treatment or an intervention. Then we've got testing, haven't we? So that might be subjective things like VAS scores. You might have objective sides of things about range of motion. Again, measuring that with tools like your handheld dynamometers often have it in, maybe using your phone, maybe using goniometers, etc. And then obviously we've got additional bits of kit that you can tap into, so force plates, force frames, maybe things like remakers, etc. That are really useful. And then in terms of kind of return to running, again, from an endurance perspective is where we need to build up. And then when it comes to training, being really particular with having an incremental increase in the number of minutes and intensity that they're going to go through. Hey, culture for me is something, and the psych side is something that people are really honing in on. So this one, talk through how you create a high performance culture in what appears like a suboptimal or toxic environment. So if you've worked in a toxic environment and it's not all nicely collaborative and open, you'll know that it starts to filter its way through into the players and the athletes, and it can really impact the quality of their performance. So again, I think just acknowledging it, recognizing it, calling it out, that it's actually something that's not working at the moment. If you've done this before, give examples, outlining why it's important, and I guess why it's not just an important thing now. So you might well do a big project piece on how to kind of improve culture. But actually, if you don't keep revisiting it, it's a bit like a garden, isn't it? So if you just plant all the things in the garden and you just water it once, that's not going to keep your garden. So you need to keep watering that garden and making sure that you keep on checking in and do that. Now, I think it's very dependent on the players sometimes who will step into that leadership role and kind of drive this forward. Ideally, you want to have as many leaders as you possibly can going in that. There are certain things which I've come across. So we used to have something that the SAS brought in, which was a hot debrief, which was something that they did after a mission, where they'd all go into a room and they'd just call out all of the bits that weren't right about that, maybe kind of really outline how unhappy they are in this sort of safe space. What we tried to do is kind of bring that in. So it was almost making sure that no one leaves anything bubbling up inside and it's actually let out. Now, obviously, depending on your players, that can go absolutely tits up potentially. But ideally, just kind of framing it correctly can be really useful. I think the backstories bit, which I know a few managers have done, where they've kind of got individuals within that team to explain their backstory and what it means to be part of the club, can be really useful. And again, things like little check-ins on a regular basis, just kind of what's your life like outside of here? Do you have additional stresses? Is there anything else going on that we need to be aware of? And actually maybe giving you a little bit of leeway and let the other players know that if someone's acting a little bit differently, a bit more subdued, a little bit more reserved, then actually there might be something else going on and it's not a personal representation of how they feel about the club. It's just there's other things going on outside of it. Talk about the positives. So again, trying to build an environment where there's accountability and that real joined up approach is great. And then obviously kind of negatives. If there's everyone blaming everybody else, whenever something goes wrong, it can be a really horrible place to be. Much like if everyone's working in their own little silos. So you might have the physio lot who just keep themselves. You might have the S&C lot who just keep themselves. And it becomes a bit cliquey. But it's great when everyone kind of taps in all of their expertise and works collaboratively. Which leaves us onto this one really. So using examples, how would you encourage a more connected and collaborative approach from the backroom staff? So again, just things that we've talked about before, really, just lots of team meetings, lots of proactivity to shadow and observe each other in your roles, seeking insights, being inquisitive, listening, and then offering your opinions, really, in terms of kind of what you think might well help. That openness is really, really important. It's something that I wish I'd probably done more of, is spent more time with coaches, had more touch points with them. So it wasn't just you going upstairs to deliver this awful news that someone else had got injured, because I think you become this sort of grim reaper who the only time that the coaches see you, they associate with bad news. So actually go up and sort of shout pretty loudly about, you know what, such and such is making great progress in whatever realm they are, or just make an excuse to go up and try and make it just more normal. From a female health perspective, this is something, again, which I think is really topical at the moment. So imagine that you've got a female athlete that's had an ACL tear, and you suspect that there were contributing factors that maybe could have been prevented. What additional considerations exist with managing a female athlete, and maybe what things were you thinking might well have contributed to that athlete getting injured? And this is where you can really highlight the differences between a male and a female athlete. So outline those risks. Again, this sort of literature is everywhere. Talk about menstrual cycles, talk about the anatomical differences like Q angles, potentially things like REDs, aesthetics in certain sports is really important. So obviously working in gymnastics, that is something that's very aesthetic. Judo is very linked to weight making. So again, making sure that there aren't things like bone density issues and people just training constantly in this relative energy deficit, really. Lots of testing that could be done. So strength work, maybe some videos, movement analysis work would have been really useful to kind of look at the way that they move. And then again, sharing that information with coaches, managers, etc. So everybody's linked up and everyone's kind of aware of the higher risk times potentially within that menstrual cycle. And can we look at bespoking that for that individual athlete? Obviously, you can talk about miles more than this. These are just a few little pointers. You could go on for ages. Okay, I think this is the last one. So how can technology be used as part of an athlete health strategy with a podium potential squad of athletes? So there's obviously a lot of things that we can do. We don't need loads of technology. You can get away with just a gym and do lots of testing there. But what sorts of things technology-wise might well push them forward? And why would we use technology? Well, you've got to highlight the importance of data. So that kind of ability to test is actually really informing for your clinical reasoning, your justification, being really clear with kind of differences between one side and the other, your LSI. That can provide motivation, transparency, goal setting, and really clear handover points. So I'm going to look after this athlete until they reach this on their strength level. Then we'll do a bit of a transition and I'll slowly pass them across to you, and then you can take them on to the next stage. Or once they hit this, then you can have them in training. It's a nice little fallback for you as a physio. Also drives conversations. So again, if you go 6 weeks ago, their strength was this is the program they've done, but actually this individual or athlete isn't actually following the process because they aren't getting stronger. If they'd done all this, then they definitely would have got stronger. So again, is it a compliance thing? Is there something missing in terms of the relationship that's there? Injury prevention, obviously kind of retrospective patterns within the squad can be really useful as well. So you can go in and test all of them as a battery of testing on a kind of a screening day, find out what's going on and go from there. This one. So a coach wants a player with an MCL injury back competing before the date you've recommended by a week. How do you manage this situation? Now, this is really common, isn't it? So coaches, managers will always want their best players back and available in training for training numbers, but also if they're a key player, then obviously it increases the chances of winning. So what sorts of things would you do if you're really being pressurized to try and manage this situation? Again, I think just acknowledging that issue is really important, and that winning culture, and actually that is fundamentally why we're in sport is to try and get as good as we possibly can. Wanting to be innovative and push boundaries within those safe parameters. So again, when we're thinking about how long an injury is going to take, we've got rough scales, haven't we? Every individual is different. This might be the norm, but actually you almost have to kind of gather all those facts, think about the time scale and plan it. But sometimes if you're going to bring it forward, that's going to come with risks, isn't it? So outlining those risks, making sure that everybody's open and understands those risks, and then gaining consent. So we've had people sign waivers and disclaimers basically to say that they're going to play against medical advice sometimes. It's very rare, so I don't do that all the time, but it is something that you can have. And then also that monitoring system. So it might be that you make this plan, that you're going to bring them back a little bit earlier, but actually, is that safe? Is that something that you are happy with? Is it something from a medical perspective you might well need to step in and refuse that they can't go back early because their injury risk is too high? Classic one with that is obviously concussion, where they haven't passed concussion protocols and there's still things going on. All right, so these are just a summarization really on the last slide of trying to demonstrate that you recognize the challenge or challenges that are there, have a balanced approach, and what's your background to that. Demonstrate your clinical expertise, and reasoning is going to be something that we really want you to really kind of showcase, and that you understand the performance demands at the high level. So again, once you get to elite level, if you don't understand the drivers that are there, that might well pull you back. Leadership, really important, having those difficult conversations and creating that open cultural environment where you kind of can discuss your disagreements potentially, but in a really professional way. So you've got accountability and collaboration. There's lots of planning and maybe delegation of roles, so you're not taking everything on yourself. Communication and being really clear with that is super important, isn't it? So you can kind of outline your thinking. And then again, just that enthusiasm and passion to continually grow and develop yourself will come through if you've done all of that work, looking at research and evidence, and then kind of reached out to other people in the industry potentially. All right, brilliant work, guys. So that is a bigger presentation. Well done with that. That is hopefully lots and lots of food for thought. These are all conversations that I've had throughout my career, some of which I've managed reasonably well. Other ones I wish I'd managed a little bit better, knowing what I know now. So I hope that was useful. Again, loads more information on growphysioacademy.com, and I'll see you in the next stage of this journey. Take it easy.